My name is Britney Sao. I am 19 years old. COVID-19 has impacted me immensely. My father was in the ICU for 45 days, and he also went to rehab. We were stuck in my house for a month because my mother kept retesting positive, so we just wasn't able to go outside or do anything like that. But in the end, everyone was safe. We were all healthy. We recovered from COVID, and if anything, COVID taught us to not let life stop you and to also just love everyone around you. So my dad went to get tested on my birthday, March 22nd. I was kind of bummed out because I was like, oh, I'm turning 19, I was gonna have a party, but then COVID happened and it kind of stopped everything. So my dad got tested on March 22nd. Oh, sorry, he went to get tested on March 22nd, but he wasn't able to get tested because at the time testing was very limited, so they denied him the testing. But at that time too, my mother knows my dad because they've been together for 20 years. So my mom was like, there's something definitely wrong with him. And I was asking around. We had a nurse from the MGH kind of help me and basically said that my father had to lie a bit more in order to get tested before it was too late. My dad did lie, and then 2 days later, he went back to MGH Boston, and he got tested. A week after, he got his results back, and he was positive. And during that time, everything just started to kind of like just go downhill from there. His condition got a lot worse. He ended up having pneumonia. He ended up being severely sick, and he just couldn't eat anything. He had diarrhea. His fevers were really, really bad. And my mother ended up catching it too, just as bad as my dad, because she was still watching over him. She was worried about him. And then right after that, after my mom caught it, I caught it too. So my symptoms weren't as severe as my mom and my dad's, but it was pretty bad compared to what my cousins said they had. I couldn't even move. Every time I walked down the stairs, I was really dizzy. I had really bad headaches. I couldn't stomach anything down. I just couldn't eat. And it was just the three of us, and we just couldn't move. And like, fortunately, my sister was able to, but since she was basically in like ground zero, we think she caught it, but she was asymptomatic. So she was able to help us around the house, and thankfully we had a lot of family nearby, and they were able to give us a lot of food and stuff, but we had so much food because we couldn't stomach anything down. So my sister ended up eating a lot of food, thankfully, because none of us was able to cook or anything. And in the end, like, my dad ended up going into the hospital because my mom's a medical assistant, so she kind of knows how my dad's condition is, and she knows when it was getting pretty bad. Like, we had to try to find him a humidifier or like a air ventilator to help him breathe because his breathing was getting really, really bad too. So right after that, he went to the hospital. Not even an hour later, we got a phone call that he went into the ICU. And then he was put to sleep because I guess he kept moving a lot. That's what the doctors told him. My mom handled a lot more of the communication aspects. But my dad ended up being admitted to the ICU right after that. And then my mom just like kind of collapsed after that. She was really sick herself too. It was just like everything was really new. We didn't really know what to do. But he was in the ICU for 45 days. The treatment he received from the doctors was like a lot. He went through multiple like stages to see if they can recover. He was immediately put on the ventilator to help him breathe. His lungs were really, really weak. The doctors said if we didn't bring him, and at that time, like, he definitely wouldn't have been able to make it. So he was put on the ventilator for 3 weeks. He had a feeding tube down in his like neck area. They had to put it in his neck, and they were just, oh no, it was in his stomach. Yeah, his feeding tube was in his stomach. Like, towards the end, like, it was getting really bad. He said that all his organs were failing. His kidneys were really failing too. They were really, really worried about his kidneys failing. And then right after that too, my dad ended up being put on this machine, like a lung transplant machine, to kind of help him breathe a lot longer. I forgot what it was called, but it's like, I know it's a machine that kind of is hooked up beside him next to his bed, and it was just transferring the good oxygen and the bad oxygen out of his body because the ventilator wasn't helping and he wasn't able to breathe on his own. And then me, my mom, and my sister, we were stuck in our house for a good month because my mother just kept retesting positive. and we just couldn't leave the house at all. Thankfully, we had a lot of family that was able to help us and bring us food and everything, but it was just April was a really rough time for me and my family. We weren't able to go to see my father. He was in the ICU, and with COVID and everything, they didn't want anyone from the outside to even go visit my father. Even when he, got released from the hospital and into rehab, we still weren't able to see my father. So since everything was still brand new with COVID, the only source of communication we were to have with my father was through his doctors. My dad was put to sleep, so we weren't even able to talk to him physically or even hear his voice for 45 days. So it was a really rough time. We couldn't see him. My mom was still really sick, so just my dad being in the hospital too made her even more sick. I was thankfully starting to get better, and I was also in school at the time. I was finishing my semester of my first year of college, and that was a really rough time too, because there was just so many deadlines, and since we transferred from like in-person schooling to online, everything was just it was just a really rough time for everyone. So we just weren't able to hear my dad for 45 days. We called the doctor every single day to receive an update on my father, regardless if it was the same or if it was not. But in the end, my dad, the doctors just said they gave us like little updates. We didn't care what the updates were. We were just like, oh, he's in the same condition as yesterday, okay, as long as he's not doing any worse. But we did get to FaceTime him one time. The doctors ended up calling us when they realized that my dad's condition was doing better. He was really, really weak though. The doctors said that he was conscious of everything, but he wasn't able to speak because he's been asleep for 45 days, so his motor functions and he wasn't able to move properly. He couldn't even open his eyes, but he was conscious of everything. He was flicking his fingers here and there, but he was just, the doctors were like, yeah, he's not able to speak for a long time. He would mumble his words, and the doctor said he asked for me, my mom, my sister a lot, so during the time. Thankfully, my entire family, even my extended family who caught it too, we're all safe and we're all healthy. When my dad got out of the hospital, he was really just anxious. Naturally he's an anxious guy. So my dad, he's never been that far away from us for that long of a time. So he was just right when he got out and he went into rehab, he called my mom. He was like, I want to go home. He was like, I want to go home now. I don't want to be here any longer. I'm doing fine. I swear I'm doing fine. And my dad's very stubborn. So he was just like, I swear I'm doing fine. You see me moving my fingers, this, and that. But we knew he needed to stay there a bit longer. So my dad's personality was the same. He did say that when he was sleeping the entire time at the hospital, he had these vivid dreams of people and his family members. He had a dream of his grandmother, of his mother that passed away 2 years ago, and of his father who's just sitting right beside him and talking to him the entire time. That's what he said he remembered. When he woke up too, he was kind of disoriented, but when he went into rehab, he kind of just it was like he never left, or never left for that long too, because he was just back to his normal self. Even when he came out of rehab, he was really weak. The first thing he wanted to do was go see his coworkers too, because he's been working there for 20 years. So he was like, that's my family too, so I'm gonna go and visit them. And then he just started working. My mom would work on the garden because that's what she loves to do. But when he came home too and he saw the garden and stuff, he would help her. And he was really weak. Mind you, my dad lost about 33 pounds when he was in the hospital. So when he came out, he basically weighed the same weight as me. And I lost 10 pounds, and mom lost about 15 pounds with COVID too, because we just didn't eat. But immediately after, I think about 2 to 3 weeks after, my dad started to regain his strength back. He also started to eat a lot more and gain his weight back to how much it was too, but that was taking a lot longer too. He was also just doing things that he would normally do. He would tell me to clean my room all the time. He was just the same person. He would clean my room for me and do all this stuff too. He's just a lot better now. It's taken a couple months. He's not 100% back to full health. He still gets really tired from time to time. He had these at the time too, when he came out, his hands were really swollen, his ankles were really swollen because he can't stand for too long. So gradually we started, my mom, my entire family, we started going on these like runs and hiking together so we can slowly regain all of our health back too. And my mom was saying how like she also is preparing for the next wave, and she thinks that even if we have the antibodies, like she's in a health field, she also understands that these antibodies are not going to last forever. She's saying that we need to regain our health, and we also started taking a lot more vitamins and probiotics too to just support our immune system, because my dad is known to get very sick very easily. And once he gets sick, my sister starts to get sick, my mom starts to get sick, and then I do. So if he were to catch it again, his immune system is still very, very weak. And with, I saw a news article the other day that a guy re-caught COVID again. So we just, with everything going on, we don't know how it is or how COVID is actually working or how it attacks the immune system. But what we're doing to prepare for it, or what we're doing as precautions, is that, we're always wearing a mask everywhere. I make sure my family has the masks. We always, like, every time we go to the store or touch anything, we have hand sanitizer immediately ready right when we go home from work, because I'm the only one working at the moment too. I, take a quick shower. I disinfect everything. We are cleaning that house daily. We're just making sure we're taking all precautions in place, because my dad is also very, like, scared of just catching it and making sure his kids don't catch it. When I caught it, he was very guilty. He thought it was all his fault, but I reassured him that it wasn't, and he just couldn't. It was inevitable. COVID is just, at this point, everyone had to have caught COVID, right, whether you didn't know or not. When COVID first reached Wuhan, China, I made I made a couple jokes. I was like, oh, it's not gonna affect me, this and that. Like, I'm not gonna catch it. I'm young, this and that. And whether you're asymptomatic or you're not, COVID is a real thing, and it's killed so many people, and especially in the U.S. So you can do basically whatever you want, as long as you're not impacting or hurting others around you, and just not masking up or saying COVID is a myth. I understand completely that you have to go to work, but at the same time, at the risk of others and at the expense of others, no one, like, I'm not going to lose my dad because someone didn't want to mask up or stay home. No life is worth that. I'm just saying, like, everyone should just take the proper precautions, especially with COVID.